Welcome to TTV. You're watching Fighting COVID. Earlier today, it was announced that the Ministry of Health will reduce the interval between two doses of COVID-19 vaccines from 10 weeks to 6 weeks from Tuesday, August 17, 2021. According to Oman News Agency, it was decided that starting from tomorrow, the Ministry of Health will reduce the time interval between two doses of COVID-19 vaccines from 10 weeks to 6 weeks. The Ministry of Health is calling on all those who received the first dose in the last period and have completed 6 weeks to register in the Tarassut program to take the second dose of the vaccine. Earlier this week, the ministry has already begun to vaccinate expats aged 18 and above in At-Tahira Governorate from Sunday. For now, the targeted group includes barbers, beauty salon staff, house help, and lastly, laborers working in farms. In addition to that, the Ministry of Health and Education is continuing a campaign to vaccinate school students aged 12 and above, which has entered its third week. Oman aims to vaccinate 320,000 students from both public and private schools. I'm sure that you all have noticed that lately the COVID-19 cases in the country have been declining tremendously. With 214 new cases today and 6 deaths, it is still very early to say that the COVID-19 can be seen going away with all the new variants emerging across the globe. In fact, according to a very interesting article written by Daniel Yetman this month for Healthline, an American website and provider of health information, there are no sure signs that you already had COVID-19. But there are some general symptoms you may have experienced, such as pink eye, loss of taste or smell, and fatigue. We'll be looking into details after this quick commercial break. Welcome back. You're watching Fighting COVID. Now, according to the World Health Organization, commonly known as WHO, more than 190 million people have been developed COVID-19 since late 2019. Many other people have likely had the disease but never received a confirmed test result, wrote Daniel. She stated that you may have had COVID-19 already without knowing it, although it's impossible to know for sure unless you undergo an antibody test. And even a positive antibody test comes with a small chance of a false positive. The most likely way to know that you had COVID-19 is if you had typical COVID-19 symptoms and received a positive diagnostic COVID-19 test when you were sick, she mentioned, before adding that even gold standard PCR tests come with a chance of a false negative result, meaning you have had COVID-19, but the test results indicated you did not. Now, according to her and as medically reviewed by Angela Bellingit, MD, if you didn't receive a positive COVID-19 test when you were sick, it's harder to know if you had the disease. Signs that you may have already had COVID-19. Well, COVID-19 can affect many different parts of your body and cause general symptoms that have many potential causes. Some people with COVID-19 don't develop any symptoms. It's impossible to know if you had an infection for sure without a positive COVID-19 test, but here are some of the potential signs. Daniel mentioned that everybody experiences COVID-19 differently and symptoms can mimic those of other respiratory infections. If you developed any of the most typical COVID-19 symptoms, especially after being in close contact with someone who had COVID-19, it may be a sign that you had it too. According to the Centers for Disease Control and Prevention, commonly known as CDC, the following are the most reported symptoms: body aches, stuffy nose or runny nose, cough, diarrhea, fatigue, fever or chills, headache, nausea, new loss of taste or smell, shortness of breath or troubling breathing, sore throat, and vomiting. COVID-19, the common cold and flu, can be difficult to tell apart. Sneezing is a symptom of COVID-19 and may indicate you had a cold or allergies. Shortness of breath isn't a typical flu symptom, but it is one of the more common COVID-19 symptoms. Now, talking about the pink eye or other eye symptoms. Some people with COVID-19 develop eye symptoms like dry eyes, pink eyes, swelling, excessive tearing, and increased eye secretions. Eye symptoms are usually accompanied by more typical COVID-19 symptoms, but they may appear alone in some people. Number 2, you temporarily lost your sense of taste or smell. Well, that's one of the symptoms I got to experience when I tested positive for COVID. And I kid you not, one of the worst symptoms to experience. In fact, loss of taste or smell is commonly reported in people with COVID-19 according to the healthcare workers across the globe. Some people with COVID-19 also experience a distortion of these senses. Symptoms affecting taste or smell seem to often appear before other symptoms. Other common symptom that Daniel mentioned, that was you develop a fever first. COVID-19 symptoms often show up in a particular order. In a 2020 study published by the University of Southern California, researchers analyzed the development of symptoms in 55,000 people with COVID-19 and compared them to the symptoms of 2,000 people with influenza. They found that the influenza most commonly started with a cough, while the initial symptom of COVID-19 was most likely to be a fever. A wide range of initial symptoms of COVID-19 have been reported in scientific literature. Just because you didn't develop a fever first doesn't necessarily mean you didn't have COVID-19. Well, this was a little revision to the most common signs that you may have had COVID-19 and didn't know. With this, we have come to the end of the episode for today, but stay tuned for more COVID-19 developments in our next episode on Monday. Keep watching and stay tuned to TTV.